My name is Tim Franska. I'm the Administrative Director of Long-Term Care. I've been with CMH since 1989. We have one facility in Dallas County, Colonial Springs Healthcare Center. We have one in Greene County, Ash Grove Healthcare Facility. Two in Cedar County. We have Lake Stockton Healthcare Facility and Community Springs Healthcare facility there in Cedar County. And then here in Polk County we have Parkview Healthcare Facility, Butterfield Residential Care Center, and a Citizens Memorial Healthcare Facility. So when I talk to new staff or new people coming in, I said I want you to take care of them as if they were your grandmother or my grandmother or loved one, because many times they are. They're our friends, they're their family, they're our neighbors, and we want to make sure they're getting the best possible care. We have 3 different levels of care. We provide independent living, which is either triplex, duplex, or apartment living, and it really is independent living. What we provide is comfort and peace of mind that you have somebody that takes care of maintenance. We take care of the security. So our next level of care is a residential care or assisted living, much like the facility in the background here. We are able to assist residents with what they need help with. Maybe it's medication management or meals, or just needing additional socialization. We are able to help them with that level of care. The residents in that care setting need to be able to navigate a pathway to safety on their own. We also help them with socialization. We have many planned activities. We have beauty shop. We have outings. So our final level of care is skilled care, and we really have multiple components there. So our first component I'm going to talk about is our skilled nursing or short-term rehab. We have a lot of individuals who maybe have a short hospital stay or have had an incident in their home or an illness, and they need some additional rehab or some additional nursing services. So we can assist with that. We have physical therapy, occupational therapy, and speech therapy. Also under skilled care is nursing. So a lot of times we'll provide IV therapy or wound care or whatever it is that a registered nurse would need to provide to make sure that you are getting to your maximum potential and able to go back home. And we try to do that in the shortest time period possible. So we have a couple of different ways to do that. We have on our website is a system called Rubric. You take a survey and it allows you to answer a series of questions, and it kind of gives you direction on where you may need to go for that care or service. Another way would be talk to your provider. The physician can oftentimes help you and direct you in what direction you need to go. And then we also have a long-term care engagement team, and that's all they do all day is help people navigate through where they need to be in the system. And they can answer your questions, financial or whether or not physically they need to be in those situations, and they'll direct you to one of our facilities that's near you to get the care and services you need. We have the full continuum of care, so no matter where you go, you have access to that medical record. Your physicians, your specialists, the facilities all have access to that record and know exactly what's happened in your history and are able to better plan for what we need to, how we need to care for you at this time. We have really 3 different levels for our pharmacy program. Having our own pharmacy enables us to make sure that we're getting the safest medication regimen possible. And something I think unique to CMH is we have embedded nurse practitioners in those facilities to assist. So when the provider is not there, we still have nurse practitioner services. And I think that aids in getting things done more timely and more efficiently. Plus, those nurse practitioners are in the building almost daily, and they know the residents very well and know what their needs are. So we provide palliative care for those who don't want or aren't ready for hospice care, but still need some additional care during that long stay. We want to make sure that we're keeping them as comfortable as possible, but still being aggressive with their treatment program. The next level would be hospice. We partner with our own CMH hospice agency, and they provide that end-of-life care. They help us with that. It's not in lieu of our staff that we have in our facilities, but in addition to. So they provide additional nursing and chaplain and social services, and really are there for not only the resident but for their families as well. And then the final component that we have is memory care. In 4 of our 7 facilities we offer memory care, and we care for those with Alzheimer's, dementia, or related diseases, and we make sure that they are in a safe environment, that it's secure, but we have staff that are trained to care for that disease process. So probably the most rewarding thing about working in long-term care is you get to learn history and stories and things that are going on. We care for the greatest generation, but I think through this pandemic, one of the things that we have figured out is we have the greatest generation of caregivers, and they are learning from our residents, and the residents are learning from them every day, and the relationships they build are really important, and I think that's what's really special about our system.